Hello, good afternoon. I'm Dr. Amanda Khosravi. I'm a family medicine physician here at Hoag Medical Group, and today I'll be discussing the treatment of nicotine dependence. So in this talk today, first I'll go over some epidemiology of tobacco use, then I'll briefly touch on the addictive nature of nicotine, and I'll go into the behavioral interventions and then the pharmacotherapy of smoking cessation. So I don't think I need to tell you that smoking is bad for you, most of us know, but here's some interesting numbers. So according to the World Health Organization, every 6 seconds someone in the world dies of tobacco use. In the world, about 7 million people die per year of tobacco-related illnesses. So here in the US, tobacco use is the #1 cause of preventable death and disease in the Tobacco use causes about 500,000 deaths each year in the US. Unfortunately, about 50% of our current smokers will die from tobacco-related illnesses. Life expectancy for smokers is about 10 years shorter, at least, in comparison to non-smokers. 1 in 5 cancer deaths are caused by smoking. Every time a smoker inhales a cigarette, they're inhaling about 7,000 different chemicals, and about 70 of these are proven to cause cancer. So the benefits of quitting smoking. Really what I want to say here is that it's never too late to quit. Within about 20 minutes of quitting, you start reversing some of those negative effects of smoking. Within 20 minutes, your blood pressure goes down, your heart rate goes down. Within about a day, your carbon monoxide level comes down. So your heart, your muscles, they're able to get more oxygen. Within a few months, your lungs start to recover, your risk of heart attack goes down. So within a short time, you're able to feel better, smell better, breathe better, taste better, and you're adding years to your life. So what makes quitting smoking so difficult? So why can't we quit cold turkey? Why can't smokers stop today, get the nicotine out of their system and be done with it? Well, the fact of the matter is, smokers are physically addicted to nicotine. So if they don't have nicotine in their body, they start withdrawing. They become irritable or anxious or restless. So when we, smoke a cigarette, that nicotine goes into our lungs, and within 11 seconds, it hits the brain. And then the brain releases these neurotransmitters, mostly dopamine, but also epinephrine, serepinephrine, norepinephrine. And what these neurotransmitters are, are pleasure neurotransmitters. So they make us feel good. The brain gets all this nicotine, it feels good, our body feels good, our body wants more of this. They want to repeat this, right? But unfortunately, nicotine as a chemical has a short half-life. So as soon as you stop smoking, the nicotine goes down. And within about 45 minutes to an hour, you start getting these withdrawal symptoms. So the body's saying, I want more, I want more. You're going to feel irritable, frustrated, angry, anxious, restless. And so what smokers usually do is they'll go smoke another cigarette. So smokers, as you can think, all day it's going up and down, up and down, up and down. So they smoke to get the hits, and then they smoke to prevent the dips. So nicotine is actually doubly addictive. You have smoking for the hits and then smoking to prevent those dips. So what nicotine does, it sits on these receptors, these nicotine receptors in the brain. Initially, we already have some, but after time of smoking and smoking, we start to produce more of these nicotine receptors. And these receptors are saying, feed me, feed me, feed me. And if you don't feed it, you're going to go through the withdrawals. And that's why it's very difficult to do cold turkey. And a lot of my patients, these withdrawal symptoms, it disrupts their life. It's very hard to deal with. So cold turkey is not necessarily the best option. Some people do it, but it's very hard. That's why things like nicotine replacement therapy, you can use it. It will sit on those nicotine receptors. It will calm those receptors, and you'll reduce your withdrawal effects, and therefore you can focus on the behavioral aspect of nicotine addiction. I'm going to grab some water. Okay, so what works? There's very good evidence that two things work. One is behavioral therapy, and the second is medications. Now, medications are independent of behavioral therapy. So behavioral therapy works and medications work. But medications plus behavioral therapy, it works better than either alone. So the treatment of tobacco dependence, the way we want to think about it, we want to think about it in two parts. One is the physiological addiction to nicotine, which medications work very well for. Then there's the behavioral aspect, the habit of using tobacco. For this, we need behavioral change program. This is why the behavioral change program and the medications work independently of each other, because there's two parts to this problem. But this is also the reason why quitting tobacco is very hard, because we need to treat both the physiological and the behavioral aspect of it. So physiologically, yes, medications work, and we'll get to that later in this talk. But first of all, let's start with the behavioral change program. This would be things like your individual counseling, your group counseling, your support systems such as your quit lines. So if you think about it like this, your smoking is a learned behavior, right? So we're not born smokers. We teach ourselves to smoke. So if we want to quit, we have to change our behavior. We have to learn a new behavior. We have to learn to now not smoke. So the best behavioral counseling, and the easiest, I think, is our quit lines. So I put up here on this slide our state-sponsored quit lines. So you can go ahead and call 1-800-QUIT-NOW from any state, and it will link you up to your state's quit line. Here in California, we have our California Smoker helpline, which is 1-800-NO-BUTS. Many of us have heard of it. They're an excellent program. You can also go to nobuts.org, which also has great resources. Here at Hoag Hospital, we have a 5-week smoking cessation program. Of course, this used to be, in session. We used to have it at both hospitals. Right now, it is virtual due to the pandemic. But here's just some information. They have it every month. We'll put this flyer in the description of the YouTube video. So if you're interested in getting in contact with them to either sign up or ask questions about this program, it will be there for you. So nowadays we're all, on our phones. So I did put this up here just in case you want to do, different support programs. So there's a text-based one, there's different apps. They're all very good. And so if you prefer these are there. Okay, now for the rest of the talk, I'm going to talk about the physiological addiction to nicotine. So the treatments for this, which are the medications. Now, we have 7 different FDA-approved smoking cessation aids. So if you go on the internet, you'll see, all these different other ways you can quit or ways people have tried, and none of those have, enough clinical studies, or none of them are FDA approved. So for my patients, I only recommend these 7 FDA approved medications. So we have our 5 different nicotine replacement therapy. So we have the over-the-counter ones, the patch, gum, and lozenge. And then we have our 2 prescriptions, which is the nicotine inhaler and nicotine spray. Then we have the non-nicotine pills, so Bupropion and Varenicline. Okay, so now what do we use? So this is from the U.S. Public Health Service. What I get from this chart basically is that each of the different pharmacotherapies, or any of them, at least double your rate of your quit success, except Varenicline, which triples your success rate. They also did some research on the combination therapies. So patch plus any short-acting nicotine replacement, so your gum, your lozenge, your inhaler, and also patch plus Bupropion. These do, if you do combination, it does increase your chance. So these are more effective than any individual pharmacotherapy by itself. So a patch plus short-term nicotine replacement more than triples your chance of quitting. So, first line, what's best? Combination of long and short-acting nicotine replacements, so patch plus gum or patch plus inhaler, patch plus lozenge. Then we have the Varenicline, and we have Bupropion as a third additional one. So on the slide, I put some special considerations. So patients who are pregnant, or if you're a smokeless tobacco user or adolescent, a very light smoker, there isn't that much evidence that shows that these pharmacotherapies help. So for this special group, first-line treatment would be just behavioral counseling. Now, before I'm going to go through, all of these different FDA-approved smoking cessation aids, there is a link that's posted on the description that goes through each of the different FDA-approved medications, and then they'll tell you the side effects, the contraindications, the dosing. So I'm going to kind of quickly go through these and mention the few points that I think are important, but you'll be able to review all of the dosing and the side effects at your own time. So nicotine gum. So I put the Nicorette picture here, but there's generics that work just as well, but the Nicorette's, pretty famous. So the nicotine gum, it's just like any other gum. It's probably the size of your thumbnail-ish, and they're sugar-free. They have lots of different flavors. There's 2 milligrams, there's 4 milligrams. I think it's a wonderful, wonderful smoking cessation aid. The one problem with it is that it's called gum, and so people think that, oh, I need to chew this, and that's the incorrect way of doing it. So I just want to point out here, just so it's done correctly. So when you get a nicotine gum, you want to do maybe, chew is a bad word, it should be bite. Do maybe 4, 5, 6 bites until you kind of get that peppery or tingly taste in your mouth, and then you want to kind of ball it up and park it right between the cheek and the gum and just let it sit there until you stop feeling that taste or that tingle. And then you'll take it out, do a couple more bites, and then again, park and cheek the gum. Oh, sorry, park between cheek and gum. So the one thing with chewing the gum is that if you chew, all the nicotine goes to the stomach. The stomach is acidic, nicotine is basic, it basically neutralizes it, and it becomes ineffective. Nicotine gum dosing. So the one thing I want to say here is, so if you smoke 25 cigarettes per day, or your first cigarette in the morning is within 30 minutes of waking up, you want to start with that 4 milligram. week 1 to 6, it says 1 piece every 1 to 2 hours. I've seen people do best when they do 1 piece every hour for at least the first few weeks. You don't want to do more than about 24 pieces per day, but you want to do at least 9. If you do 1 every hour, you fall within that range, and people do tend to do a little better. And if you do it once every hour, at least for those first few weeks, and then slowly you can do it every 2 hours and then every 3, and slowly bring it down over the next 12 weeks. But if you go a little over that, that's completely fine. Now, nicotine gum side effects. So most of these side effects are from using it improperly. So people who are chewing the gum or chewing it too fast. So that's oftentimes why they'll get the jaw pain or even that nausea or indigestion. So when people come in with side effects, that usually means that they're not using it correctly. So you want to make sure you're using it correctly. Another key point is that you want to make sure you're not eating or drinking at least 15 minutes before chewing or while using it, because that will make it ineffective. If you're drinking coffee, juices, anything, those are acidic, it's going to make it inactive. If you're drinking water with it, that'll just bring all the nicotine to the stomach. So you want to make sure you don't eat or drink for at least 15 minutes before and while using the nicotine gum. I think the nicotine gum is good for people who use smoking when they're bored. So they use it to take up time, or their job is boring, because it takes work all day long. You're going to be chewing gum. It's also good for people who are afraid of waking with quitting smoking, because you have very limited time to eat in these situations. Because if you're having a gum every hour and then 15 minutes before you can't eat or drink, it gives you a very limited time to eat. So it helps combat any fears of kind of gaining weight. So nicotine lozenges, these work very similar to the gum. It's again sugar-free, it comes in different flavors. We have a 2 milligram, we have a 4 milligram. It's in 2 different forms. We have your original, which is about the size of maybe a Tums, and then the minis, which are maybe the size of a Tic Tac. And the thing about the nicotine lozenge, you actually get more nicotine, and it's not because it has more nicotine, because it's the same amount, but it's because most people use it correctly, or it's as opposed to the gum. So because of that, if you can't use the gum correctly, or if it's not socially acceptable at your job to be chewing gum, the nicotine lozenge is a great choice. The dosing, again, is very similar to the gum. The only difference is you're not chewing the lozenge, you're just allowing it to kind of slowly dissolve in the mouth. Again, these side effects from the nicotine lozenge are generally people who are using it wrong. If you're kind of nibbling at it, or you're sucking on it too hard, it can often give side effects. Again, same as the gum, you want to make sure you're not eating or drinking about 15 minutes before or while using the nicotine lozenge. The nicotine patch. So the nicotine patch, it's kind of like a Band-Aid. You put it on the skin where it's clean, dry, hairless. The reason I say hairless is because some men will put it on their upper arm, and if they have hair in the area, they're actually not getting the full effect from that nicotine patch. So you want to make sure you're putting it somewhere above the waist that's hairless. Unlike the nicotine gum and the nicotine lozenge, that you can kind of slowly taper down how much you're having yourself, the nicotine patch comes in 3 different steps. So it's very designated steps. You can't kind of wean yourself off as you want. The patch, the benefits of it is you can wear it, it will last 24 hours. It's actually kind of made for people who have those withdrawal symptoms in the morning. So you're sleeping all night, you're not getting any nicotine, you wake up with those withdrawals. This is to help hopefully combat those withdrawals. Now again, the dosing, it's going to be in the forms that are linked into the description. But it's about a 10-week program. Again, if you want to make it a little longer, completely fine. If you're smoking less than 10 cigarettes per day, you want to start around step 2 and then do that for 6 weeks and then go to step 3. Your nicotine patch side effects, because the nicotine patch is topical, it's placed on the skin, it can cause, of course, skin irritation, itching, burning, tingling. Some people will get the symptoms when they take it off. It might get red, or you might get that itching in that area. In those cases, I'd recommend not wearing it at night so that you get less time where that adhesive is on the skin. Of course, make sure you're moving it around. You don't want to put it on the same place every day. Vivid dreams or sleep disturbances. Some people say they get, these colorful, very lively dreams, and they actually like it. But if it is bothersome to you, of course, I would remove the nicotine patch at night, and that might help. So the next two that we're going to discuss, the nicotine nasal spray and inhaler, those are prescriptions. Now, your nicotine nasal spray, it's not very often used or prescribed, and the reason being is it irritates the throat and the nose. People don't tolerate it well. Most people stop in less than a week. So most pharmacies aren't even carrying this, so I'm not going to go through it very much. It's not very prescribed, but just letting you know that it is out there. Nicotine inhaler, again, this isn't prescribed as much. Some pharmacies don't have it, but it is definitely more prescribed than your nasal spray. So there's a mouthpiece to this and your cartridges. Over the day, you want to, you smoke it like a cigarette, basically. You can start with 16 cartridges and then slowly come down over the next 12 weeks. But each cartridge contains about 4 milligrams when you puff it. So after 20 minutes of using the cartridge, delivers about 4 milligrams of nicotine vapor. Now we're going to get into the pills. So the pills, the first one we're going to talk about is Bupropion, a non-nicotine cessation pill. It's actually an antidepressant, so you might know people who are on Wellbutrin, Zyban, Bupropion, and they're using it as a form of antidepressant, but it's also a great cessation pill. The reason it's great is because it increases dopamine and norepinephrine in the brain. And as I said, in the first few slides, those are the two neurotransmitters that are released by nicotine. So if your dopamine and norepinephrine in the brain is increasing, you're getting decreased cravings for the cigarette and decreased symptoms of nicotine withdrawal. So contraindications, this means, we don't want you to use it. And this is for patients who have seizure disorders. Or if you're in any situation where your seizure threshold decreases. So some certain medications will do that. If you're anorexic or bulimic or have a history of it, the electrolyte balance puts you more at risk for seizures. If you're, use any benzos like Xanax, or you drink and you want to abruptly stop, your risk for seizures increases. So we want you also not to use Bupropion. Bupropion does decrease the seizure threshold, so that's why these are contraindications. So precautions. Precautions just mean that, we want to observe you a little closer. Back before 2016, Bupropion did have a black box warning. They had it on all antidepressants for a while, but after 2016 it got removed. But the black box warning was it can cause depression, suicidal ideation, psychosis. But after doing lots of studies, they saw that actually it doesn't. But in this group of people, so people with any psychiatric disorder or depression, we want you to just follow up with your doctor a little closer so we can monitor these symptoms. If you do get any of these symptoms, of course, discontinue and you would call your doctor. The dosing for Bupropion, you want to stop about 1 to 2 weeks before your quit date, you want to start the medication, and then after about 1 to 2 weeks, then you'll stop smoking. So the first few days, you just do 1 tablet, and then you go ahead and do 2 tablets for about 12 weeks. Again, you can go over 12 weeks if you want. This is especially good for patients who might have some like mild depression, but also want to quit smoking. It helps a lot because it's also an antidepressant. So side effects, the most common side effect I hear from my patients is that they can't sleep, so insomnia. The one thing that does help is to take the medication earlier in the day. So you want to try to avoid taking it closer to bedtime. It can cause insomnia. Varenicline, so this is Chantix. Most of us have heard of it as Chantix. So it's a non-nicotine prescription medication. It's specifically for smoking cessation. There's no other medication like it right now out there for this. The way that Chantix works is that it targets these nicotine receptors. It sits on those nicotine receptors. And when it sits on those nicotine receptors, it increases dopamine just a bit, which helps with those symptoms of nicotine withdrawal. But also, since it's sitting on those receptors, if you smoke, for especially good for patients who relapse, if they go take a cigarette and want to smoke, you're not going to get that pleasure out of it because your nicotine receptors are already occupied by Chantix. So the dosing for Varenicline is a little bit more complicated. You do want to start the medication about a week before quitting. But there is a starter pack, and it makes it a lot easier to follow the instructions and quit. But eventually, you want to be on 1 tablet twice a day for about 12 weeks, and then you can continue it for another 12 weeks if needed. So Varenicline also did have a black box warning at one point. That was also removed in 2016 when they saw that it was truly not causing any suicidal ideation or depression or psychosis. But for patients who do have some underlying issues with this, you do want to make sure that you're following up with your either primary care or whoever prescribed it a little closer just to monitor for these symptoms. If you have any of the symptoms, discontinue and call your doctor. The most common side effects of Varenicline would be nausea, sleep disturbance. I hear a lot of patients do get abnormal dreams, feeling very bloated, constipated, headache. About 10 to 20% of people who do start this medication, Chantix, do stop within a month. So it is more than 5% of people do get side effects. So if you do get any side effects, of course, discontinue, and there's 6 other options out there for you. So just some final thoughts. Anyone can quit with a proper tailored plan. There's 2 parts to the plan: the behavioral change program, which teaches you to cope with the situation in which you used to smoke, but now you're not smoking, and also a cessation medication, which allows you to comfortably quit smoking. Research does show that it takes about 10 to 12 tries before you can actually quit smoking. So I say this because it drives home the point that it is very difficult to quit. But slips and relapses, those are normal. It happens. So I don't want you to get discouraged if it takes you several tries to quit. That is very normal. You just want to keep at it and keep trying. So you haven't failed until you stop trying. Now, if there's any questions, I'll take any questions. Okay. I smoke a few cigarettes a day or not every day. Are my health risks lower than those of a person that smokes more often? So yes and no. It doesn't take much. It only takes a few cigarettes to get the health risk of the cardiovascular risk, so the increased risk of heart attack and the increased risk of stroke. So in that sense, no, it does not lower your risk for that. But as far as lung cancer or lung-related diseases, yes, it does decrease your risk for that. But I would say it's best to completely quit smoking just because you don't want the cardiovascular health risk. Is that it?
No, there's one more. Isn't it? There's one more. One more question?
Oh.
Yeah, no more questions.
Okay, so thank you everyone for listening, and I hope you learned something from this. If you have any questions, you can call my office, 949-791-3103. I hope you guys are all successful in your quit attempt. Have a good day.